Chris, thanks. More than 3,200 Ohioans are in the hospital because of COVID, and 899 are in the ICU. Cases continue to go up. Lead investigator Brian Duggar joins us to discuss this situation. And Brian, I see a lot on social media giving data and interacting with people. Just go through and list some of the most common questions and statements you're hearing right now.
I know, yeah. I mean, I do get a lot of interaction, and some of it people with serious questions and others just kind of being negative about it. But here's some of the questions I get. So if I get the vaccine, I can still get COVID, so why bother? Yes, if you get the vaccine, there's a chance that you can get COVID, but you have to remember that the main point of the vaccine is to keep you from getting seriously ill, and it does do that. Over the past week, 90% of hospitalizations and 95% of the deaths have been unvaccinated. So there are plenty of hospital beds available. What's the big deal? You're right, there's 21.5% of Ohio's hospital beds and ICU beds are available, but the health department yesterday in their briefing, they said it's not the beds the problem. We aren't going to run out of those, but the healthcare workers, they're mentally and physically exhausted, and several of them have quit over the course of the pandemic. They're just worn out. COVID simply doesn't affect kids, so why does it matter? Well, that's simply not true. There's been 9 people between the ages of 0 and 19 in the course of the pandemic who have died. There's been 2,000 people in that age group who have been hospitalized. And in the last 3 days, there's been 7,200 people between the ages of 0 and 19 who have been reported as testing positive for the virus. Natural immunity is good as the vaccine. Well, there was a study out of Israel that showed that, yeah, there is a lot of protection for people who have already been infected. But there's more evidence and growing evidence, including from the CDC, that if you're infected and then get the vaccine, you have much less chance of being reinfected. What's the mortality rate of COVID? People always say 1%. Well, in the total number of people who have tested positive in Ohio, about 2% of that total have ended up dying. Yes, that's not a large number, but 5% of that total have ended up in the hospital. And of course, there are many long-term effects that, are going to just stick with people for a long time. So it's much more serious than just deaths.
All right, and there are some definite reasons out there, Brian, that people feel strongly about, that they're not getting vaccinated despite the incentives and despite the convenience now to get a vaccine. So probably a good thing that you're answering those questions tonight. Thanks so much, Brian.